I would like to introduce Dr. Jennifer Kaumeyer. Thank you very much.
Thank you. Thanks, everybody. How's everyone doing this afternoon? How's the lunch? Good? Good. Well, we got a big crowd here tonight. I'm so glad everybody could come. We're going to talk about naturopathic medicine, healing the body naturally. I hope you guys find this interesting. I hope I don't put anyone to sleep. Tiffany gave you a little brief synopsis of myself. I am new to the Riordan Clinic. I'm new to Wichita. I'm new to Kansas. I'm new to the Midwest. I moved here from North Carolina, from the Raleigh-Durham, Chapel Hill area, where I had my own private practice for 3 years. And loved it there. It was great, but decided private practice was not my style. I kind of got tired of wearing 20 hats every day, and was like, if I could be anywhere, where would I want to be? And I was like, a clinic just like this one. I knew of this clinic through my father, who had been here. He's a physician. I'm the fifth generation doctor in my family. First female, first to go more natural route, yet, you know, back in the day it was more natural. My great-grandfather was a doctor, my grandfather, my dad, and my great-grandfather was actually, there's a movie about him, if any history buffs out there, the story of Dr. Wassel, and it comes on AMC sometimes. He was in the Navy, and Gary Cooper played him. Anyway, I have 2 kids, a 6-year-old girl named Gracie, and a very demanding, high-maintenance 1-year-old little boy who is the love of my life, but I guess like all men, they're very needy. And so when I'm not here and I'm not in my work and with my family, and they're the loves of my life, and next to my career. I have a lot of passion for this. I have a lot of passion for naturopathic medicine, as you'll see as we go along. I have a presentation here to keep me on track. However, I do take tangents sometimes and explain things, and hopefully you guys will get a lot out of this talk. So let's go ahead and get started. All right, so this is the agenda for today. We're going to just briefly go over a definition, talk about our education and training. Everyone always asks about that. Licensing and regulation according to different states in this country. Treatment modalities, the naturopathic principles, which is kind of like our commandments, or the rules we follow, and then the naturopathic therapeutic order, which I think is the most important part, and you'll get a better understanding of naturopathic medicine once we go over that. And that's just the approach to patient care, how we look at a person when they come into our office, and how we go about figuring out treatments and stuff like that. So feel free to ask any questions along the way. Just raise your hand. We've got a big group here today, but raise your hand, and I welcome questions if it's pertaining to what we're talking about. So don't be bashful. If you have that question, I'm sure someone else does. And so let's get started. So these are just a couple definitions, and as we go through there, these will be further explained. But naturopathic medicine is a distinct healthcare system, just like your MDs, which is termed allopathic, your DOs, which are osteopathic, and then your chiropractors. They all have their own set of different beliefs that make them a little different than the other. So we're just one of those. And we address the root cause of illness, that's the main thing with naturopathic medicine, and we seek to restore, promote, and maintain optimal health, okay? We aren't, naturopathic medicine is not just using natural substances in the place of pharmaceuticals for treatment, suppression, or just to treat a symptom. So another definition that I like is we blend modern scientific knowledge with traditional natural forms of therapies. Okay, and then you're probably looking at me like, well, what does that mean? And we'll learn as we go along what all that means, okay? So a little bit about our training, not to bore you guys, but this is rather important question people ask me. So to get into ND school, it's just like any other medical school. You have to have a bachelor degree with your 3 years of pre-medical requisites, anatomies and biologies and biochemistry and organic chemistry that everyone loves. And it is a 4-year program, where just like any traditional school, and I'll briefly walk you through what we learn in those years. So we have 4,500 hours in the classroom and over 1,500 hours of clinical experience. And so the first year, basic sciences again, anatomy and all the fun stuff, memorizing lots of things. We do learn pharmacology too. So yes, we do learn about medications and standard of care and how to prescribe and all that is very important, especially with herbal medicine and, known contraindications and stuff like that. And we do learn pathology. study of disease, you know, all the different diseases and stuff. The second year, we get into more of the clinical disciplines, such as, you know, lab diagnosis, understanding labs and lab values and what's normal and what presents in certain diseases and such. So the second year, you get into more of the clinical stuff and learning really, this is where the skill of medicine comes in. You're learning how to differentially diagnose and applying what you learn in the first year. Radiology and the naturopathic assessment. So, you know, we have a lot of things in our black bag to use for treatments. That's not really, I think really what makes us distinct is our therapeutic order and how we address treatment. But we learn a lot of naturopathic modalities, which we'll talk about in just a second, on top of pharmacology and minor surgery, you know, stitching people up and taking out lipomas and stuff like that. We do also learn and can do. So, okay, so the naturopathic disciplines in the third year we start learning on top of getting into the clinic, and those disciplines are listed here, and I talk a little bit more about them. But we are skilled, very highly skilled in clinical nutrition, botanical medicine, which is herbs, herbal medicine, traditional Chinese medicine and acupuncture. We do learn homeopathic medicine, hydrotherapy, which is using water for treatment, water, hot, cold, hot, you know, all that stuff, which is very effective. We'll talk about that in a minute. And naturopathic manipulation, which is similar to chiropractic stuff. I don't do any of that in my practice. And lifestyle counseling. Clinical nutrition, I'll talk real quick. We're very different from nutritionists. We of course know what nutrients are part of what foods and everything, but we really use nutrition from a biochemical standpoint. So what nutrients push certain pathways and make certain hormones, and you know, if you're deficient in one, what symptoms that could cause, and such forth. So it's a little different than just talking about nutrients and diet. And then clinical experience. So we spend over 1,500 hours in rotations in various settings, of course with NDs, other naturopathic physicians, medical doctors as well, DOs, which are doctors of osteopathic medicine, chiropractors, acupuncturists, and everything. Like, for instance, I spent a lot of my time with a rheumatologist in Phoenix. That's where I went to school, Phoenix, by the way. And because I have a real big interest for rheumatology and autoimmune diseases and things like that. So I think I have a big interest in anything that we don't really know much about. I like studying it and figuring it out. I really want to be House one day. Do y'all watch that show, House? So licensing and regulation, you know, every state's different in licensing everything. So doctors, you know, every license you can get is different per state. And in the state of Kansas, there is licensing and regulations of NDs, meaning that there is a board in Kansas. We are regulated. We are considered healthcare providers in Kansas. Not so much in other states, so you're lucky. And in some states, all insurance cover naturopaths, Vermont, New Hampshire, Oregon, Washington. You know, your Blue Cross Blue Shield will cover our services in those states, just not, I don't think here, I'm not sure yet. In North Carolina, they don't. I was practicing actually in an unlicensed state, which just means that there are no laws, and anyone can call them a naturopath, and which is, can be, there's a safety issue for the public with that, and they're working on getting laws passed in North Carolina. That's a whole other talk for another day. Okay, so the disciplines that I talked about, these are just kind of our tools in our black bag that we carry with us. We don't really have a black bag, but clinical nutrition, so it's dietary counseling, IV therapy, supplementation. You know, we do a lot of nutrient testing, which is one reason why I'm glad to be here, because I can do that with my patients. Botanical medicine, using herbs. Again, I use herbs more of manipulating biochemistry rather than just treating symptoms. Traditional Chinese and Oriental medicine, which is acupuncture, we do learn a lot of. I don't utilize much of that in my practice. Homeopathic medicine. This is something a lot of people get mixed up, because they confuse homeopathy with naturopathy, which are, homeopathy is actually a subset of naturopathy. So, and that's another like whole day conversation one day. We'll talk about homeopathic medicine. Naturopathic and lifestyle counseling and hydrotherapy. I don't do much homeopathy in my practice, by the way. I focus more on biochemistry and clinical nutrition and botanical medicine and stuff like that. So hydrotherapy, again, using hot, cold, hot and cold, and ice packs and heat, which is a very effective treatment for a whole lot of things. Musculoskeletal detoxification. It's just getting the patient to do it. People have a hard time. Better than anti-inflammatories, better than a whole lot of things, but yeah, and that's including myself at times, so I'm a victim of that. All right, so here are the principles. So this is kind of like I said before, like our rules or our commandments that we follow. And if we're not following these, then we're not really a true naturopathic doctor. So I'll go through each and every one of these and explain them. But the first one is first do no harm. They're written in Latin on the right. So primum non nocere, nocere or nocere, however you want to say it. Identify and treat the cause, totally causum. Support the healing power of nature, or healing power of the body, which is vis medicatrix naturae. Treat the whole person. Doctor as teacher, which means docere, which docere means doctor. The emphasis, and then emphasizing prevention. Prevention, prevention, prevention. And that just doesn't mean screening. It means really preventing things, okay? And we'll go through each and every one of these and then talk about it. All right, so first, do no harm. So this means a whole lot of things. And first, it means, utilizing non-toxic therapies first. Now, there are always the case where, we're taught to recognize this, where surgery or something more invasive is probably the best option at first. And that's also first doing no harm. I would never let someone go and not have a tumor cut out that I think should be cut out. That's 99% curable. I would still recommend that if I knew that. Of course, addressing everything else. So we like to utilize more gentle, non-invasive therapies. And really, first doing no harm is following our therapeutic order, which we're going to talk about in a minute. Following the order of how we address patient care and treating people's ailments. So what I'm going to do is kind of give you examples using the case of eczema. And I use that because I see eczema all the time for some reason, whether it's somebody's primary concern or their second or tertiary concern. I see a lot of eczema. So eczema is a skin condition, inflammatory skin condition, caused by a whole lot of things. A lot of people never know what's caused. But so first doing no harm would be, first addressing dietary modification. Food intolerances from the diet can cause lots of inflammation in the body. A whole lot of things can cause inflammation. But we would do that before doing topical steroids. I mean, topical steroids help with calming the inflammation down, but it's still not getting to the cause. And if I was to tell you to do that first, that would be not following the first do no harm. And of course, there are times where that might be a great thing. If you have a child who's scratching and it's getting infected and you might want to use it temporarily, but that is something that never should be used long term. It's very bad for the skin. So when I see that happening, I make sure that we address this and the patient gets off the cream. So. The second principle is tole causum, which is identify and treat the cause. Now, that's easier said than done. A lot of what we do in the first visit is a lot of listening and trying in the first few months of when I see someone with chronic ailments is investigating, do a lot of investigating to what is causing their problem. Why is this happening to them? And what I was taught in med school was that by a lot of doctors, some doctors I've been practicing for 30, 40 years, was that if you sit and listen long enough, if you sit and listen to the patient, to everything they have to say, they will tell you what's wrong. And most of the time that's true, to an extent. They will tell you what route to go and help formulate that strategic plan if you just listen to what they have to say. So that's a very important part of what NDs do, is a lot of listening. Okay, and identify and treat the cause. So the cause symptoms, we view symptoms as not the real problem. Symptoms is just the body trying to tell you what's going on, what something's wrong. A good example I like to use is a cough. When you have the flu or a cold, it's normal. Most people have this cough that lingers anywhere from a week to 3 weeks. And that is just the body trying to get rid of mucus that was produced to catch the virus and get out of the body. And suppressing the cough is not a good thing. Okay, that's not the cause of what's going on. So the underlying cause can be usually some kind of lifestyle, something in the environment, diet, lifestyle habits, physiological imbalances, environment, psychological imbalances. There's a whole stream of causes. But so the case of the eczema. So common causes of eczema that I've seen in my practice, constipation. You probably didn't think the GI tract was related to your skin, but it is. And that's about treating the whole person, which we'll talk about in just a minute. Poor digestion, food allergies and sensitivities can cause eczema. Compromised liver function and the inability to detox things very well can cause eczema. Stress in general can cause eczema. And I really hate that word stress because I think people don't really understand, or stress is used too much. People don't understand what stress is. People come to see me and they say, oh, I'm not stressed out. And then we talk and I'm like, oh, you're stressed out. Stress can be overstimulation, TV on all the time, alarm clock going off, traffic. All of that is messing up your hormones. You're going crazy. It's just overstimulation. And a good example of this, I was with my son. This was last year sometime. I was sitting there. It was one morning. It wasn't a stressful time. He's playing with all these things they give kids now with the lights flashing and speaking Spanish to him and all this stuff. And I'm sitting there and I'm like, oh my gosh, that thing's driving me nuts. And I'm like, what is he thinking right now? You know, this poor little baby under all this stimulation and stuff. And anyway, in my opinion, that's just stress for the child, and I'm all about bringing back the Lincoln Logs and Tinker Toys and all that stuff. But that stimulation, that TV in the background, I mean, we'll address that with patients. Watching the news at night sometimes can be pretty stressful for people, you know, because they don't talk about much good stuff. So anyhow, sorry, I'm going off on a tangent there. So the healing power of nature is another principle. It's the third principle. And, you know, our bodies are miraculous creations. It's amazing. I really learned this when I took my embryology class in college. And that's when I really got interested in naturopathic medicine because it was just amazing. And, you know, if you give the body what it needs and prevents and take away toxicities and things the body doesn't need and address every part of the person, the body will heal itself. You know, you scratch yourself, a scab is formed, you didn't do anything to it. It will do what it needs to do. And it does so internally, too. With your blood vessel, scabs are formed, and your organ scabs are formed, and the body will heal itself, but you have to give it the right environment. So that's why I like utilizing a lot of nutrient testing, too, and really getting to the biochemical makeup of the person because it just helps heal people quicker and for me to understand them as an individual. So, all right. So healing power of nature with the case of eczema. You know, addressing food intolerances, improving digestion, relieving nutrient deficiencies and excesses, you know, especially with fatty acids, is common deficiency in people with eczema. Yeah, dietary changes, supplementation, that's all kind of the power of healing, the healing power of nature, instead of just using topical steroids. The fourth principle is treating the whole person. So this is where the term holistic comes from, meaning whole person. And this means, you know, head to toe, inside and out. If you come to me with a migraine headache, I'm not going to just zone in on your head. But I will ask about everything else, especially your digestion. That's a big part of migraine headaches. You know, even your nails can tell me a whole lot about your health. Your nails actually tell you a lot about someone's health. So, you know, you really want to treat the whole person and examine the whole person because sometimes you find something that's seemingly unrelated to your problem can actually be the missing puzzle to that, or missing piece to that puzzle. So we really stress treating the whole person. And that also means not just top to bottom, inside and out. It means your mind, your health, your mind, your social environment, your emotions, everything, all that, your spiritual life, all that's part of treating the person and treating the cause too. So a lot of doctors don't ask a lot about that, you know, past history of stress and abuse, and that's really, really important. And something I want to say that I found in my private practice that just overwhelmed me, that I couldn't believe, is just the amount of abuse that's happening in people's lives and that are never addressed, never talked about, and it's shocking. And a lot of people, that's some of the cause of their chronic ailments. And doing everything else and not addressing that is not, you know, naturopathic medicine. We will address a lot of that too. So, let's see. Yeah, so treating the whole person is also like we treat the person, not the disease. We see everyone as individuals, you know. I don't have a standard protocol for every lupus patient that walks in my door or every person with chronic migraines. You know, it's always individualized because everyone is so different and their causes can be different. Like for eczema, you know, I've seen people that it just happened with stress and just doing or psychological stress in their lives and doing some counseling and stress management techniques and things like that cured up their eczema. And other people, it's caused by the cold air and temperature changes. A lot of people with fatty acid deficiencies, that's very common because that's not in our diet anymore. That's a talk for another day too. And anyway, there's a whole lot of causes of eczema that need to be looked at, and it's not the same for everyone. Okay, doctor is teacher. So docere means to teach. That's what doctor means. So anyone who's a doctor, PhD, medical doctor, just kind of means that you have the ability to teach. You know enough to teach. And in my opinion, education is power. So I try to educate patients on everything, sometimes a little too much, but I'm getting better with that. I really want patients to understand what's going on with their body, what we're doing treatment-wise, and why. And not only for the sake of just knowing, but when people know what's happening, they tend to be more compliant, more excited, more motivated, and they will get better, and they will get better quicker. And so I will always educate my patient, even during a physical exam, why I'm examining something, you know, what it's telling me and why it's happening this way. I just think it's important that the patient knows. And one of my goals one day is actually to change the science classes in high school, because I think everyone should leave high school knowing basic physiology, you know, what happens to food when you eat it. You know, I asked my mom that the other day and she had no idea, you know. So, you know, I think that's something that's important, and people will take care of themselves better if they know what's happening. So we don't need to learn about frogs in high school. So I don't think so. Maybe in college. All right. So we act as health coaches, kind of. You know, we're not gods. Doctors aren't gods, and we know that, and we know that we don't heal people, but we just guide people and give them the tools that they need to heal themselves. And we want the patient to take responsibility and to be active in their health care. Today's modern medicine is more of a passive approach, meaning the patient doesn't have too much say, and there's a good balance in between that. I do think some people do a little too much reading on the internet, and but I mean, I'm glad it's there. I'm glad people can read it. But there's so much, you know, you can find conflicting information for anything on the internet. So, but I do think that that's a very important part, that the patient takes responsibility, and they're the ones having to do the work, not the doctor. So, all right. The sixth principle is health promotion is the best prevention. So health is not just the absence of disease, right? How many times do you hear, or I don't know, I hear all the time, but I was fine until I turned 50, and then it's like everything fell apart. Well, they weren't fine, probably. It's just little things that start building up, and it's best to address that first. You know, I had a friend, you know, who was saying, "Oh, I don't have any health complaints," and I'm thinking to myself, you've been complaining about your IBS and your migraines and this and that. And I'm like, you have a lot of complaints, you know. So those things can be addressed, even if you don't have a formal diagnosis. You know, you can start changing that. Yeah, so prevention is not just, you know, going and get your colonoscopy and your mammogram every year. So there's more to it than that. So most people just go to the doctor. I was reading for the 2 top things that people go to the doctor for. Does anyone know what they are? No one? No one? No one? Can you guess? Stitches? Well, yeah. You definitely go to the doctor in the hospital if you need to be sewn up. Do not come to me, please. Do not sew up any arms or legs. Pain and rashes, skin rashes. I guess it's because of the aesthetic, you know, quality of skin rashes. But you should be more active in preventing things. All right, so this is, I think, the most important part of explaining what naturopathic medicine is. And this is just our therapeutic order, how we approach patient care. So there's 8 steps, kind of in ascending order. of how we go. This is kind of a learned skill that we learn, in school. It's also partly intuitive as well. So the first thing is identify and remove the cause or the obstacle. Okay. The second one is establish a healthy regimen. The third is stimulate self-healing. The fourth is strengthening weakened systems. So I just listed some common ones: the immune system, the gastrointestinal system, and the endocrine system, which is your hormones. Correct structural integrity, restore and regenerate, address pathology, which is disease. And the last one is to suppress pathology and more invasive modalities such as surgery and chemo and radiation and thus. So usually you go through sometimes in one visit I might go through the first 4 steps. Sometimes with a person, with the case of the migraine, you might just get to step 1 and that person migraines are gone just by eliminating the cause. I had a patient one time who the cause of her migraines was the excessive amount of food dye she was eating in her diet. And as soon as we removed that, her migraines went away. But of course, she continued to see me to do every other step to prevent any other health complaints. So sometimes you don't need to go to all the steps. Sometimes you got to go to step 8 and then go to step 1 through 7. It just depends on not too often though. Okay, so removing the obstacles to cure. So for instance, physical toxins in our life, cigarette smoke, food additives, pesticides, herbicides, formaldehyde exposures everywhere. Recognizing and avoiding emotional toxins as well. That's one that's not commonly looked at. So negative people in your lives, abusive spouses or family members, all need to be addressed because that's all causing problems in someone's physiology, biochemistry, and their health. All right, so establishing a healthy regimen. So not necessarily just, go eat right and exercise, because you hear that all the time, but what does that mean? But a healthy regimen would be healthy eating, which I would help someone with. So a lot of people come into me saying they have a healthy diet, and I look at it, and they don't realize a lot of the toxicity that they're eating, and it's not necessarily the healthiest that we can do some improvements. It doesn't mean you have to eat boring, tasteless foods, but you can have a very exciting diet and eat healthy. Healthy movement and exercise. Healthy thinking. Okay, a lot of people, a lot of their problems are from their own thoughts and how they think of themselves and how they think about life, and a lot of some techniques that can be done to change that around. Healthy relationships. Healthy work environment, healthy home, and then also I didn't put in there healthy spirituality. Is another one that needs to be looked at, okay? All right, so one of the next on the therapeutic order list is strengthening weakened systems. And so I listed the top 4 that I usually address: the immune system, the liver and detoxification system, gastrointestinal system, which probably should be listed first because that's, in my opinion, the most important system, and then your endocrine, your balancing hormones. So I want, I have people walking in, I put these little flower pictures from there, but I have people walking in looking like the first flower, and then I want to see them leaving like the second flower, okay? And go through each system and talk about some general ways an ND will address these systems, and that all varies per person, and I didn't go into specifics about things, but some important things I wanted to list is lots of colorful vegetables, antioxidants, bioflavonoids, and there are other phytochemicals in the food. And vegetables, we're learning, I was reading somewhere in a paper about how they're researching there's so many components of food we don't even know what they are, and that there are clues that they are turning on and off our DNA and genes, and you can change your genetic makeup by how you eat. So that is possible, just so you know that. Vitamin C, vitamin C, vitamin C. Vitamin C we're known for vitamin C here at the Riordan Clinic, but vitamin C is part of basically every organ system, from your bones to your muscles to your cartilage to your immune system to your heart. We're the only primates and a fruit-eating bat that don't make their own vitamin C from sugar. And I think we have the enzyme to make it, or don't we, Dr. Ron? Yeah. We have, and guinea pigs don't too. You're right, guinea pigs don't either. But I think a primate eats like 6,000 milligrams a day or 10,000 milligrams a day in just their normal diet. And we get maybe like, what's our RDA, 60? I don't know, that's just to prevent scurvy. So drinking filtered water, so no fluoride and chlorine. That affects your immune system and your overall metabolism. Improving digestion and eliminating parasites can help the immune system. And here's just a list of herbs also that I first came to my head when I thought that are immune stimulate: echinacea, astragalus, myrrh, Siberian ginseng, panax ginseng, all used for different people. You know, I wouldn't use all these in everybody, and I would use specific ones for different people. That's where individuality comes in too. So, sleep, huge. Half the people I see have a sleep problem. So that is very important for your immune system, regulating your hormones, getting your circadian rhythm where it needs to be. You know, circadian rhythm is kind of your daily fluctuation of hormones. Women have a monthly fluctuation. There's also a daily fluctuation. And, you know, it's all part of, you know, the sun affects your circadian rhythm, all of that. Very interesting. But I think there's really a truth to that saying, early to bed, early to rise makes a man healthy, wealthy, and wise. That keeps your circadian rhythm where it needs to be, your hormone production where it needs to be. And so that's very important. They're out there. They've done a lot of research on night owls and people who have the night shift, and, you know, nurses and the graveyard shift at, you know, gas stations and stuff, and they have a lot of health problems, higher cancer rates and things like that. So that's why you need to open your blinds in the morning, keep it all dimmed in the evening. So go out. It's better. I mean, go out and walk in the morning. Go out and walk in the evening. Let the moonlight hit your body, and that has some beneficial effects too. So, hot and cold showers, always ending in cold. Cold showers are great for stimulating the immune system. Really shunts the blood into your internal organs, especially if you do it on your adrenal glands right here in your back by your kidneys. Great way to start your day. Okay. Anybody do that? I do sometimes. You do? We got one person. Oh, 3 people. Oh, great. Hot, cold showers? Yeah, great. Good, I like to hear that. Deep breathing to increase oxygen. You want to oxygenate your cells. You get oxygen from breathing. How many times do you hold your breath? I want you guys to go home today and really be aware of how you breathe. I know I hold my breath when I'm driving sometimes, and I'm working on that. I think it's because I get stressed out on the road. Especially on that 96 when it's raining in the morning and there's lights and you can't see the lines in the road. You'd think they'd repaint those things. I'm trying to get here and you can't even, there's no reflectors around here in Kansas. Which, who should I call for that? Anybody here in charge of that? DOT. There's no reflectors in the middle of the road, and it's awful when it's raining. Okay. Avoid stress, excessive fear, anxiety, and depression. Again, easier said than done, but that's where a lot of the thought-blocking protocols can come in. People live in anxiety and fear, especially in this country. It's just everything is so fear-based. Causes health problems, okay? Because we're all scared of everything. Most of us, anyway. So, decreasing inflammation. So, increasing fats that are anti-inflammatory. So, ones that push the body to make things that are anti-inflammatory in the body are your omega-3s. That's why they're kind of in the news. It's kind of the thing to do now, right? So, fatty fish, grass-fed, wild meat. Does anybody know why grass-fed meat, grass-fed beef is better than corn-fed? I know. No. Yeah, no antibiotics. But they also make more omega-3s. The metabolism of grass in the cow produces more omega-3s than the corn-fed. The corn-fed produce the saturated fats, the real marbly, good-tasting fats. But the omega-3s are much healthier for us. Reducing fats that are inflammatory, so animal fats, trans fats. Trans fats are artificially made fats. And what they've done is they've taken vegetable oil, because if you put butter in processed food, it expires very quick, okay, because butter goes rancid. But they've taken vegetable oils that don't go rancid at room temperature, and they've hydrogenated to make it from a liquid to a solid, so that they can put it in Twinkies and Oreos and, you know, all your food that you find in boxes on the shelf. The thing about trans fats is they're shaped differently, and so when your body absorbs it, sees it as foreign, and when it goes into the cell membrane, it can change the shape of the cell and cause all kind of health problems, diabetes and all kind of things. That's why, like, I think it's Denmark, that's it. They ban trans fats in restaurants and on the shelf and everywhere. New York State, I think, has banned them from restaurants. New York City has, like McDonald's and places like that, use trans fats when they fry their fries. That's why McDonald's is bad versus you making your own fries. They hydrogenate it so that the oil lasts longer, and that they don't, you know, they save a lot of money doing that. So, Eating a very colorful diet. Again, I already talked about that, all the stuff that's in vegetables and stuff. Very great for a decrease in inflammation. And that herbs that are anti-inflammatory are the following. So your frankincense, turmeric, bromelain, vitamin E, and vitamin C are some nutrients too that are anti-inflammatory. So I'm sure you might have heard of some of those before. Frankincense, isn't that one of the things the three wise men carried, and myrrh? And okay. Metabolism of fats. Okay, this is very complicated. I don't need you to memorize this. I'm not going to test you on it. But the reason I put it up there was for two purposes. One, to show you how complicated it is. And that all, I don't know if you can read that, but these are your omega-3 fats. These are your omega-6. These are your animal fats down here. These make pro-inflammation. These are anti-inflammatory. So your cold water fish and stuff goes straight to making anti-inflammatory stuff. Now your flax and your walnuts and stuff take a little bit longer, and they require a whole lot of nutrients. So B3, B6, B5, biotin, vitamin C, magnesium, zinc. Now if you're deficient in any of those, then like magnesium, which is very deficient in the American diet, you're going to have a problem making these things. Okay, and that's where your biochemistry kind of gets whacked out. Magnesium is also a part of making serotonin. Which a lot of people are low in serotonin, supposedly. And zinc and B6 are part of making serotonin as well. And so that's where clinical nutrition kind of comes in. It's kind of an example, a little bit. But this is very complicated. And like you see here, upregulated by insulin. So if you're insulin resistant, you're making a whole lot of insulin because you're pre-diabetic, going to shunt to make pro-inflammatory stuff. So all that stuff has to be looked at, okay? Liver function and detoxification, so you want to decrease toxicities, avoiding food additives. I will be doing a talk in 2 weeks on food additives, if anybody wants to come. Keeping regular bowel movements. I always ask people about their bowel movements. They look at me like I'm crazy, but very important to tell me about the health of the person. Vegetables from the brassica family can help with detoxification, especially with hormones. Fasting, hydrotherapy, castor oil pack, sauna, dry skin, brushing, deep breathing, all that stuff can help with detoxification. I'm going to give you a little picture. This is very blurry, I know. I just couldn't find a better picture. But I just kind of wanted to show you how complicated the liver is. Well, this is a very simplified version. But there's a lot to detox. You go to the store and buy these little colon cleanses. That's not a detox, okay? That's a purge. You're purging your colon. But detox, and you have all these little steps in the liver, step 1 and step 2. In step 1, you have all these toxins that are fat soluble, meaning they dissolve in fat, and you can't really mix fat with water, right? Because oil and vinegar, oil and water don't mix. So they have to go through the liver to be made water soluble so that the body can excrete it via the gallbladder or the kidneys or the bowel or the urine, whatever. There's specific things go different ways. But step 1 and step 2, a lot of times step 1 is very, very fast in people. And what happens is that sometimes the end product of step 1 is more toxic than the toxin itself. And because step 1 is so fast and step 2 is not going fast enough because of deficiencies and problems, that toxic substance can be very toxic to the liver. Okay, that's why you probably, if you're taking meds, sometimes they say don't take grapefruit juice, don't drink. That's because it's affecting these little pathways. And you see, you probably heard milk thistle in the liver. I'm sure everyone's heard of milk thistle in the liver. So what milk thistle does is that it slows down step 1 so that it can catch up with step 2. So that you're not producing all these toxic substances that's going to be toxic to the liver. Okay, that's how it protects the liver. Okay, it doesn't protect many other parts of the body, but it protects the liver. And brassica family, cruciferous vegetable that I talked about a second ago, will help speed up step 2. Okay, that's where it's being worked. So you heard of things like DIM and indole-3-carbinol and things like that. That's part of broccoli, very concentrated. That's what it does for detoxification. So if you read some of those detox things, you'll probably see some of those on the back of the bottle. But you got to make sure it's in the right dosage, and that's where our specialty kind of comes in. You need to be therapeutically dosing things. So you want to better your digestion, okay, very important. IBS, irritable bowel syndrome, it's just crazy. So many people have irritable bowel syndrome. They don't really know what a normal bowel movement is or regularity is. But some ways to better your digestion is using bitters or digestive enzymes, bile, hydrochloric acid even I give people at times. And, bitters just increase the digestive juices so your body starts secreting them. There's some examples of bitters for you. You probably heard of some of those. Dandelion. Dandelion's also a diuretic too. Testing stools for parasites and yeast overgrowth and things like that, that's really predominant. Certain medication, antibiotics, birth control pills, alcohol, that's what ETOH is. I saw I put that. I didn't know if everyone knew that's alcohol. Alcohol, fluoridated water, chlorine, all that can cause what's called dysbiosis, so that the good bacteria in your gut are killed by the bad bacteria and yeast, and they overgrow and cause all kind of problems, okay? A lot of people have low hydrochloric acid, which causes reflux in people. It's not about how much hydrochloric acid you're secreting. It's about that little flap over your stomach, staying closed or open. Glutamine, very healing to the gut. It's the primary source of fuel for the colon cells. So anyone with ulcerative colitis or something, do well with glutamine, okay? As well as people on chemotherapy and stuff, that's really messing up their intestinal cells in their tract. Chemotherapy really kills off those cells rather quickly. So that's good for those patients as well. Balancing hormones. Oh, wait, okay, got 10 minutes. Balancing hormones, adrenal hormones, so your cortisol, your aldosterone, which is part of electrolyte and fluid balance. And I just kind of listed some herbs that are used commonly for some of these hormone. You probably heard of some of them: licorice, rhodiola, holy basil, schisandra. Thyroid, male-female hormones. So, you know, your bladderwrack, your lycopus melissa, those are just herbs that can help with hyperthyroid, Graves' disease, things like that. Vitex chaste tree, very great herb with affecting the pituitary gland, the female hormones. Semicifugia, you probably heard black cohosh for hot flashes. It's not a phytoestrogen that people think it is, but it's not. But it does affect the estrogen receptor, so it can help with hot flashes and things at the right dose. Blood sugar hormones too, very, very, very important. Insulin, glucagon are two of them. So chromium, gymnema, alpha-lipoic acid, cinnamon, and bitter melon are things that can help with prediabetes, insulin resistance, things like that. That's a very widespread problem in America. So I see a lot of insulin resistance prediabetics and diabetics as well. Very controllable disease, very much can be reversed too. So that's a little bit about our therapeutic order. Just a little bit about the visits. People ask me a lot about that. The normal visit with a naturopath will be anywhere from an hour, sometimes 2.5 hours with some doctors. Basically, it's a lot of investigating, listening, gathering information. We do full physical. We'll review your past labs and imaging and recommend additional testing if necessary. We can refer out. You know, we know when to refer out. So if you need an ultrasound of your ovaries, you know, we can refer you out for that. We won't let you go without doing that. Most of the first visit is a lot of, like I just said, a lot of listening and gathering information, and really developing an individualized plan for you based on the 6 principles in the therapeutic order. So it's a big, you know, naturopathic medicine. If you haven't seen already, it's pretty you know, individualized, and it takes a lot of skill and some intuition a little bit too. What do we treat? We treat people. We don't treat conditions. We do know the terminology and the slang to talk about, you know, conditions and diagnoses and stuff, but we treat the person, not the disease, okay? We work with a wide range of people from all health concerns, from your eczema to your cancer patients, diabetes, autoimmunity, lupus, rheumatoid arthritis, things like that. It's not necessarily a replacement for allopathic care all the time. We can, you know, I'm trained to act as a primary care physician in Arizona, but, you know, you still need to have that allopathic touch for certain things. Like I said, don't come to me if you know, your arm's falling off or anything. So we most often work with the healthcare team. So we'll talk to your doctors and write letters and all that jazz too. So, all right. So clinical success. Here's some lists of things. I particularly really like female disorders: endometriosis, PCOS, polycystic ovarian syndrome, diabetes, gastrointestinal, IBS, IBD, things like that, Crohn's, ulcerative colitis, all those. I really enjoy working with people with those complaints, but I see a range of everything. All right, so when to refer to an ND. I have this slide in here because I did this talk for a bunch of medical doctors one time, but I think it's still good to keep in there. So these are examples of when you might want to see an ND. If it's kind of worded a little different, but when you express an interest in complementary health care, looking for additional support, counseling to maintain and improve your health. I don't want to read this to you, but if you're self-prescribing herbs, probably best to see an ND, because how often do I see, oh, I tried that, it didn't help, and I look at that, I tell them to bring everything in, let me see what you tried, and it's just things over the counter, not at the right doses, they're not, you're not taking it the right way, with food, without food, or how you're supposed to take it. So I see a lot of that. Or you're looking for more information on disease management in addition to your conventional protocols, okay? Because we work really well even with your primary care physician. So a lot of my patients are on medication, and that's fine. And a lot of times they want to get off medication, and I help them do that. So, okay. So if you've not had success with conventional therapies, you have digestive problems or require advanced nutritional advice. Most doctors do not address digestion and absorption and things like that. I have never, gastroenterologists never ask what you're eating. Well, if you know one, let me know them, because I'm going to refer all my patients to that one. So if you're having any of that, I would always suggest having an ND, because you really won't get much of that in conventional care. Poor immunity, viral infections. So for more information, these are some websites that you can go to. That's naturopathic.org. SENM is my school. Those are 2 other schools here. That's it. I hope you guys got some good information. Any questions or anything? Please raise your hand and ask. I love questions. I always have someone that stumps me, and I've already been stumped. So let's see if I can be stumped again. I'm not so sure about Kansas yet. We don't, like here, we don't take insurance, but we can give you forms to try to get reimbursed. From my experience with private practice, it was a nightmare. Part of the reason why I did not want to be in private practice anymore was dealing with insurance companies, because they always deny the first time regardless. That's kind of the rule I've seen. So, but then they sometimes end up covering. But some people did get reimbursed, especially Blue Cross Blue Shield, national or federal got reimbursed. I saw a lot in North Carolina. So quite a few people did. But in other states, like I said, we could contract with insurance companies. So Vermont, New Hampshire, Connecticut, West Coast, Portland, Washington, things like that. Those states. Just not in the middle of the United States, Kansas yet. I mean, you really want to alkalinize your blood. So I don't know how much alkalinizing, I don't know enough about it. Your stomach needs to be very acidic, but your blood needs to be alkalinized. And I don't, you got to be careful with some things, so I don't. Okay, I didn't go into explain that very much, and that was mainly because I don't do too much of that, but I do refer out for those kinds of things. Physical, like having a functional short leg versus a long leg, chiropractors are good with that. Massage therapy, working out, or active release therapy, things like that, working out different muscle, tissue stuff, things like that. That's what that is. I didn't speak much about it just because I don't utilize a lot of that, because we do learn manipulation and things like that. I never was very interested in that. I just kind of said, leave that for the chiropractors. And I was kind of focused on what I was very interested in. So, in my experience in North Carolina, I had no problem. Even with Duke being there, it is the city of medicine. Not very impressed with it, but yeah, they had no problem working with me, talking to me. They were very professional. Some doctors gave my patients a hard time, and I said, go find a new doctor. And they have their concerns. They don't know enough about, and I understand that. My very best friend's a doctor. My dad was a doctor. They know more about what I do. There's a lot of especially in North Carolina, there's no laws there, and so there are people that get online degrees and call themselves naturopaths from and they're just learning nutrition and herbs for symptoms and stuff. And especially in North Carolina, there was an instance where a Clayton graduate took insulin from a type 1 diabetic and gave us a very bad name. No ND in the right mind, or even in a crazy mind, would do that. So, did that answer your question? Yeah, my experience was fine. I had no problem working with people's doctors. And I always had, when I was in North Carolina, I always had referrals, because a lot of times people weren't happy with their primary care anyway. And I always say, you really need to have a very good relationship with your doctor, and if you don't, then you might want to go find a new one, because your health is very important. Okay, probably the most important, thing in your life. All right.